Breast asymmetry is when you have different sizes of your breast. So meaning the left breast is very different to your right breast. Now, how can we correct this? Okay, if you have a mild asymmetry, you've got maybe like a quarter of a size smaller on one side versus another, and you're coming in for a breast augmentation, well, then you can use a mildly different size of the implant. Let's say you're putting in a 300 on one side, you could put 325 or 350. But a lot of patients come in where they have very different breasts. They could have a flat breast on one side and a sagging large breast on the other. And in those situations, fixing the asymmetry with an implant is just not going to work. So if you have, for example, if you come in with a small breast on one side and a small nipple and a very large breast on the other side with a large nipple that is sagging, this is your fold. So on the left side, you're pretty much flat. On the right side, the breast kind of goes down like this. You cannot fix that with just an implant. So in these situations, obviously what we want to do is make the smaller one bigger and the bigger one smaller and lifted, okay? And we have to make the nipple smaller as well to match the other side. So there's many different situations that we look at here on how to actually make them symmetric. So I'll give you an example. You've got a left breast, it's relatively flat, it's relatively narrow, and with a small nipple. And on the right side, you have a wider breast that is sagging with a much bigger areola. If we put an implant, so the idea obviously would be, let's put a big implant here and let's just reduce this and lift this. If we put, when you look at implants, you see that the implants, not only when they become smaller, change in size, but they also change in diameter. So then they're smaller compared to the bigger implants. So if you put two different sizes, you're going to change the diameter of the breast as well. So you got to keep that into consideration as well. So for example, if I put in a very big implant on the left side, I need to also put an implant on the right side to improve or make the cleavage somewhat symmetric. Meaning, if I put a big implant on the left and I reduce the right side, the pole here will be relatively flat. So if you have a big implant here and you reduce this, you still kind of have to put a small implant here so that the cleavage tends to be symmetric. So what we normally do in that situation is I say, okay, fine, I need to make my new nipple in this area and the same size. All this is extra skin. I bring this up, I make it smaller so the new nipple is here, and I close this. At the end, you will end up with, on the right, a smaller nipple that matches the other side, a line that goes down, and a horizontal line here. Plus, we will have to put an implant here to match the cleavage on the other side. And on the left side, it will essentially be the same, but the nipple here with a much larger implant. So this is what we do for large asymmetries. If the asymmetry is very big, where you have almost flat on one side and a huge breast on the other, this is what we would do. Now, sometimes having done this, I would say, okay, well, this is still a bit wider. Occasionally, we can liposuction this to narrow it down to match the other side as well. So there are many tools that we can use with breast asymmetries. Now, do we have to use an implant on the right side if I've used an implant on the left? Well, if the right breast tissue is hard so that when you lift it, it stays rounded, sometimes we can get away without it. But in general, I can just imagine if you put in a very big implant on one side and you've just lifted the other side, there's no way you can match that cleavage unless you put a small implant as well on the other side. So those are the tools that we have to create more symmetry. Number one, we can use an implant on the smaller side, and sometimes we have to use it on the bigger side as well. We can reduce the bigger breast, and we can add some liposuction to narrow the breast so that it matches the narrowness of the other side.